Hi, welcome back. Today we're here with board certified dermatologist Dr. Kiracofe of Airia Dermatology in the Chicago area. Thank you so much for joining us.
Thank you. Thank you. I know our name could be tricky sometimes. Airia Comprehensive Dermatology, not always how it's spelled, but I say that about my last name too. No one would know that it's pronounced Kiracofe. So happy to be here.
Thanks. I'm sure you get a ton of questions about aging skin and what people do for moisturizer. And is it true that our skin dries as we age?
Yes. So it's such a good question. The number of times per day that I have some variation of this conversation is really innumerable. But the truth is that from the age of 20, every year after, we're actually losing collagen instead of building collagen. And also as we age, in our skin, our natural moisturizing factors, our ceramides, things that give hydration to our skin also go down. And so that's when we see the natural effects of aging, which is then, of course, compounded by ultraviolet radiation from the sun and sun damage, not that we've experienced in our adult life, but the sun damage that we've experienced before we were even 21 years old. And so that can manifest in kind of dark spots, sunspots. It can manifest as fine lines and wrinkles, sometimes discoloration in the skin, sometimes blood vessels, or more noticeable rosacea. So there's lots of things that can kind of show up in aging skin.
Okay, good. So those would be like age spots.
Yes. And so there are lots of people have so many different names for them, sunspots. Some of my patients call them liver spots. They used to have a terrible name, which was called senile lentigos, which luckily is not what we call them anymore. But they just mean as the skin ages, it's more susceptible to damage, and that damage shows up in different ways. Sometimes of the skin being less resilient, meaning more easy to tear or more easily to get bruised. Also for that radiation from the sun to kind of show up as, different kind of like freckles of aging. And so and then sometimes some other spots that are not sun induced can show up as well.
All right. So does diet and hydration affect my skin? And if so, what can I eat to make my skin glow and be healthy?
Yeah, so diet and hydration definitely have an important impact. And what's important to remember is that your skin, hair, and nails are some of the most rapidly dividing cells in the entire body. So what's really important is that we're feeding those foundational building blocks. So that means having a diet that's rich in antioxidants. What I tell my patients is it's really important to have lots of bright colors on your plate. So that doesn't mean that you have to only eat pomegranates or only eat blueberries, but it means that you need produce and fresh items in your diet that are providing those antioxidants. And hydration is super important. It's not, there is though like a limiting factor. Like you can, if you drink 3 gallons of water, a day, you're not necessarily going to have the look of, super hydrated skin, but you do need to maintain adequate hydration. So I always say 6 glasses of water, 8 hours of sleep, a multivitamin, and a probiotic. When it comes to skin health, those things are really important. Not everyone may need the multivitamin and the probiotic, and that's a conversation they can have with you. But for a lot of my patients, when they're looking to optimize, those are some of the things to consider, in addition to, of course, having a good skincare routine.
Oh, I love it. Thank you so much. It's super helpful. So, okay, we all get wrinkles. We know they're coming if they're not already here. And there's a ton of different treatments that are available, going from topicals to injectables. And I just kind of wanted to get your feedback as a board certified dermatologist about what treatment options you think are best and which ones are maybe have more risk associated.
Yeah, it's a really good question. So I would say the top 3 foundational things that everyone should have in their skincare routine, if they're concerned about, or just want to be vigilant about their skin aging and want to optimize that, is that you need an SPF that's greater than 30 every single day. And it needs to be one that you love so that you'll wear it every day. You need to have a good moisturizer to provide the hydration from the skin that we just naturally lose as we age. And then the most important thing, the most important initial active ingredient that I usually suggest for my patients is a topical retinoid. And we could do an entire 2-hour session on all the things I have to talk about with regard to topical retinoids. But what's important to know is that there's a full spectrum of topical retinoids, and there's ones that you can get over the counter at CVS or at Saks, and then there's professional and prescription strength that you can get in your dermatologist's office. And so, but what's most important is finding that product that's specifically right for you. And what's always kind of a disappointment to me sometimes is patients will come in for a Botox consult or want to do a laser or something like that, and they're not optimized on their topical skincare routine, which, it's kind of I don't know, I can't think of a good analogy right now, but, it's not doing the easy things, and
paint on a rust or something.
Say it again.
Putting paint on top of rust.
There we go. Yeah. And so, I wouldn't, and I kind of think of the skin like a tablecloth. And so, the skin is kind of the tablecloth of the face. And there's different things that we can do with that tablecloth. So we can have different scaffolding under the tablecloth. If you go to an event and they might have the dinner rolls and the salad up higher than, something else on the table because they're using different risers and scaffolding beneath the tablecloth. That's kind of the structure of the skin. That's our bone structure. That's our fat. But then there's the tablecloth itself. And, no matter what structure you have in the skin, if you take out a tablecloth that you used at last Thanksgiving that has gravy stains and is wrinkled, and you try and, put that on the most beautifully scaffolded and structured, face, it's just not going to look as good. So what I always advocate for is washing the tablecloth first, meaning doing the topical skincare routine, buffing out and polishing the skin in the way that we can, mainly because that's the least expensive way to do it and the safest. And then once you've done that, if there's still areas that are left behind, some people struggle with some tough 11 lines, in between the eyes. Sometimes topicals are not going to be able to take care of that. And that's okay. That's where something like Botox comes in. And that's what helps handle the wrinkles. And so, so there's kind of different tiers of ways to consider the anti-aging process, but always being on a good skincare routine and developing that skincare routine with someone that understands your skin is so important. The number of times patients have come into my office with $600 worth of products from Sephora. And I'm well, these are the reasons that you have this rash on your face and why you're not actually getting benefit from the products. It's not that the products are bad. They're just not right for that patient at that time. And so when I see patients in the office, I have them bring in, I just say, take your bathroom counter and just everything that's on it, just dump it into a bag and bring it in. And we'll use, what we can of the products, because a lot of my patients have invested in good things, but they might be using something in the morning that should optimally be used at night, or vice versa. Or they might be mixing, an antioxidant with a retinoid that shouldn't be mixed. And so, so those are some things, and kind of the low-hanging fruit, those easy considerations of making sure that you're using products that are suitable for your skin tone and your skin type, and are actually addressing your concerns. We want to have an intentional skincare routine. Not everybody needs a $200 antioxidant, and so that's a product that's important if it's important for you. And so that's something that's really important for patients to think about, because there's so much just stuff, whether it's social media or blog posts, everybody thinks that they know what to tell you for your skin. But really it's your doctor that will give you the best advice of what to consider, when to think about adding a topical retinoid, and which topical retinoid is right for you. And then when to consider other procedures that you might be interested in, like Botox, microneedling, dermaplaning, laser, lots of things that are good options, but we want to start with the foundation first.
Oh my gosh, thank you so much. This has been awesome. We're so appreciative, and you're helping us stop the clock on our skin.
Yes.
So let us know how we can get a hold of you for our dermatology needs.
Yeah, absolutely. So I'm the founder of Airia Comprehensive Dermatology, which is a comprehensive dermatology practice that is in the Fulton Market area, kind of right on the edge of West Loop and Fulton Market. And you can reach us on our Instagram page, which is Dr. Kiracofe MD, also on our website, which is ariadermatology.com. Or you can just Google my name and our Google pops up, and you can both text and email our phone number, which is 847-766-0829. We'd love to see you in the office.
Awesome. Thanks so much for your time today.
Absolutely. Thanks for having me.
Take care.